But we also have co-registration cases with IFR. Is a patient with inferior steel elevation MI undergoing primary PCI in the right coronary artery with a good result. But the angiography in the left coronary artery showed intermediate lesion in distal left main and a probable significant lesion in mid-LAD. That is not really clear if this lesion is severe, it's just a borderline lesion. After 3 days during admission, is our strategy that after the culprit lesion PCI, we stage the procedure for evaluating the non-culprit lesion. But in this case, we have the surprise of a thrombus, non-occlusive thrombus in the right coronary artery that was fixed, treated with a balloon, and was finally solved. And then we could move to the left coronary artery when we have the, as I mentioned just before, the intermediate lesion in distal left main and a probable significant lesion in mid-LAD. These are the angiographies showing what I am describing. We did the examination with the IFR, and in obtuse marginal in the circumflex, you can see we have negative values for IFR and FFR. In mid-LAD, we have positive values. We have IFR 0.73, FFR 0.68. But if we do a measurement, yes, distal to the left main, but proximal to the mid-LAD lesion, their values are 0.99 for IFR and 0.94 FFR, provided there is a lesion distal to this point of measurement. These are the co-registrations. For the circ, we see a negative value with just some pressure drop, minor pressure drop in proximal circ. But in LAD and left main is the most interesting because we see clearly that the lesion in mid-LAD is really responsible of the positive values we see distally. Then it's clear that we have to treat the lesion in mid-LAD, as we did in this case. We implanted a stent in mid-LAD, and post-implantation, the FFR was 0.82 and the AFR 0.88, both in the gray zone, but based on the characteristics of this case and these values and everything, we decided to stop the procedure here. This is the co-registration for the result just after the stenting, and you see the left main, the lesion in the distal left main has only 0.01 drops of drop in pressure, then it's really a non-significant left main. Other cases, for example, this patient had primary PCI in LAD. You see in the left hand side the occluded artery, in the right the treated artery. We saw an intermediate lesion in distal left main, and we interrogated this lesion with the IFR and FFR. In circ, the result was the same, 0.89 for both, surprisingly, and in LAD was 0.181 for IFR and 0.82 for FFR. Then we have mostly negative reading in circ, borderline for IFR but negative for FFR, and in LAD we could see that IFR was positive and FFR was not, then which is interesting. This is the co-registration. In the circ, in the left hand side, you see some drop in the distal left main, but not definitely significant. And in the right hand side, we see that the left main could be really more significant because we see 0.81 just distally. We perform IVUS in this case because it's interesting to see what happens with these lesions when there are some discrepancies in the readings. And you see a clear plaque present in the distal left main with a lumen 6.4, which is really a typical lumen in the borderline. Usually over 6 could be safe to defer, but in this case it's 6.4. And in this case, I stop here because this case is planned to be to do a PCI procedure, repeating the physiological measurements and IVUS, just being a bit more distance from the STEMI, steel elevation MI, that has 2 weeks ago, and in 2 weeks we plan to study this patient.